with Dana today. Dana, thank you for coming out.
Oh, my pleasure.
We wanted to talk about just some aspects of the veterinary hospital to hopefully help build the client and veterinary team relationship. And what we'd really like to get out of it is that the patients really get the care that they need and deserve. The client's needs are met as well. And then everybody on the pet care team, that they walk away knowing that they've been able to communicate better with the clients and that the clients have a better understanding of what the pet care team goes through too.
Right.
So Dana and I worked together for a couple of years ago. So before we get started, Dana, tell me why you got into this field and just some of your thoughts on, you know, what makes you happy about the field, why you chose this, and what you hope to get out of it.
Okay. Well, it was definitely a late life change for me. I had been working in some form of design for many, many years, whether it was visual merchandising and design, interior design. I also worked in management, in retail settings. And although I love design, that's really kind of where my, a lot of my talents lie. I just love animals, always have. And I guess I got laid off from my job as a manager in a retail environment. I kind of floundered for a little bit, didn't look for a job right away, wasn't sure I wanted to do, and the more I thought about it and the more soul searching I did, the more I realized I just love being with my dog and I love pets, and more I started realizing that I kind of wanted to pursue a career in some way, shape, or form working with them. And I did start a little dog walking business that I did in my neighborhood, and I really enjoyed that. And then I started volunteering, doing dog rescue. And so that kind of brought me to working in a low-cost spay-neuter clinic here in town at the Help Spay-Neuter Clinic. I enjoyed that for several months, and then I interviewed at Dogwood. I had tried to get jobs in veterinary clinics for quite some time, but until I worked at Help Spay-Neuter and kind of had a little rescue experience, there wasn't much interest. So once that was part of my life, it was a lot easier to get involved in it.
Yeah. One of the things that I remember the most about you was not only your energy, but your passion. Both of those things really shined through when you and I first met. And so I was really happy to have the opportunity to work for you. I thought you'd be great for the field. The
thing that you did too that I really appreciated is, even though I didn't have a ton of pet experience, I had a lot of customer service experience. And so the fact that you thought that would translate well along with my passion and all of that to the job was really, I appreciated that, because that gave me my opportunity to, you know, kind of break into it. And I love it just as much today as I did that first day. So
I'm so glad to hear that.
I love it.
I'm really glad to hear that. Dana has got a really fun personality, and for anybody who works with her, you can really see how much she cares for the animals and really wants everybody to have a good experience and to do what's right by the animals too. So in your particular job now, what would you say is one or two things that you're most passionate about at this moment?
I would say probably number one is just educating the client. You know, there are so many things, I guess, that working in the field you take for granted, that this knowledge that you have that everybody knows, and they don't. And just something as small as, you know, heartworms, for instance. They think that this is some sort of a worm that the dog catches from other dogs, and so they don't realize how easy it is for a dog to get heartworms if they're not protected. And so, you know, it's through a mosquito. It has nothing to do with contact through another dog and all of that. So the education part is really big. When I explain something to a client and the light goes off all of a sudden, they go, oh, and they start to understand, that's huge. That makes me feel really good. And just making the clients feel like they've chosen the right vet to come to. So when they walk into our environment, that they feel that they're in the right place, that they don't feel uncomfortable, that they are comfortable there, that we make them feel at home, that we love their pet, you know, that we enjoy them. And you know, that's super important, because if they don't feel that way, I mean, I try to put myself in their shoes. I don't want to walk in some place where I just don't feel like I'm in the right place for me and my pet.
Absolutely.
Yeah.
I think that's a really good point, and I'm glad that you brought that up. I guess that kind of leads me to a question I was going to ask a little bit later, but since you mentioned it, we can talk about it now. What are some ways that you, or what are some techniques that you do, or how do you make clients feel comfortable and welcome?
My memory is not the best, but I try and remember their name. Obviously, everybody likes when somebody calls them by their name.
Right.
So it's always Mr. and Mrs. unless they ask me to call them by the first name. And I do have several clients now, having been at this particular clinic now for about 3 years. I do have several clients that they look at me and they say, please don't call me Mrs. So-and-so, call me by my first name. And so I will in that case, but, you know, connecting to them on a one-on-one basis is very important, and connecting with their pet. I mean, you know, you can talk to them and make them feel at home, but if you ignore their pet and don't acknowledge their presence and make their pet feel welcome and comfortable, you're not doing anything really. So it's a combination of both. You know, the client walks in the door and they're the first person that you should be addressing, but you have to acknowledge the pet, which is not hard for me because that's my favorite part of the job is interacting with the animal.
She could take home every single animal, or she would take home every single animal if she could.
Especially puppies. But yeah, it's just, you know, you have to connect with them and the pet. And you have to make it, you have to make them feel at ease that you care about both of them, not just one or the other, but both.
Mm-hmm. It's funny that you should bring that up too, because I've heard stories, like even from my own mother at one point, I think it was her, my memory's bad too sometimes, about, you know, the vet or somebody else, not even, you know, somebody else in the hospital, if it's a technician or receptionist, not even acknowledging the pet or not getting down on the floor with the pet. And to me, that seems like just such a natural thing to do. And yeah, if you're in a hospital that doesn't do that, what kind of message does that send to the pet owner?
Exactly.
Definitely, you know, clients, I think, want to see that you love their pet just as much as, you know, you love interacting with them.
Definitely, and coming around out from behind that desk when they first walk in is a huge part of that. You know, it's not always possible. Sometimes you're extremely busy and you don't have the time to maybe personally greet as much as you want to, but wherever possible, to come around from behind that desk and interact with them in the lobby and, you know, pet the dog, pet the cat, sit down next to them if you have a few minutes, talk with them, have a conversation, rather than always being in that, you know, professional role. You want to kind of get one-to-one, friend to friend, face to face, heart to heart. Yeah.
I think it's real easy to lose sight of the personal connections, and I think that all of us, whether we're in the veterinary field or anything else, if we can learn to connect better, we can certainly build better relationships.
Oh, definitely.
So.
Yeah, without a doubt.
Okay.